Some of the mistakes that I want to make sure people are aware of now that we have started the Medicare AEP season began officially today, of course, and will go through December 7th. And so I want to cover those mistakes, explain why I believe these are mistakes and ways that you can avoid them. And then the second thing we're going to do is I'm going to take your questions that you have concerning Medicare as well as Social Security. So anything that you want to ask, feel free to put that in the chat. As always, I ask you to make sure that we can understand your question. Sometimes people are trying to be so condensed or concise in their questions that we can't really understand what you're asking. So be clear on that, and then some of our staff will be monitoring those here in a few minutes, and they'll feed those questions to me. I also want to say that if you are our client, we are grateful that you have chosen to use us as your broker. And we do have lots of ways this year that you can get help. And so I want to mention those. Every day at 1 o'clock, we are doing live streams with our clients. It's a Q&A time, and so really you're welcome to join those every day if you're a client. So that's 1 p.m. Central Time, and then every day at 2 o'clock. We also have an opportunity for you to be able to get help on doing the drug plan switches. We walk through live situations, your meds, and happy to assist. You can kind of watch and, of course, do that on your own. So if you'd like to do that, it's every day at 2 o'clock. And anyway, so as a client, we've already sent information to you where you can access those. So please avail yourselves of those opportunities because we do want to make sure you're on the right plan for 2026. All right, so every day at 1 o'clock, Q&A and any matter that you want, and every day at 2 o'clock, that's when we're going to be addressing prescription drug plans. All right, well, let's get started. Again, glad to have you tonight. I hope our time together will be enjoyable and profitable for you. So we're going to go through the mistakes. And by the way, these are not in any order of importance. I could have listed probably 10 mistakes, but we're going to kind of keep it to 5 tonight. And so the first one may be obvious, but I want to mention it just because we're now getting in, first day of AEP, and that's this. I think it's a mistake if you're covered by a Medicare Advantage plan or a standalone prescription drug plan. It's a mistake if you assume that the plan that you're on today, if you like that plan, and just you assume that you're going to be happy with that plan next year, and then it's going to be the best plan. And it may be, but I would ask you, don't assume that, please. I know sometimes the tendency is, hey, I liked it this year, I'm sure it's going to be great. And then you may not do your due diligence that I would say is necessary this year. Folks, there's just too many changes to not take some time to make sure you're on the right plan. Okay, so I'm talking about those plans that are annual, and most of you would know Advantage plans are annual plans, and standalone prescription drug plans are annual plans. Med Sup plans are lifetime, so it's really not an issue about Med Sups at this time of the year. But just assume that their plan has changed to some degree. We know that some have changed drastically. In fact, we know 2 million people have had their Medicare Advantage plans terminated going into 2026. That's a big change. But just do some research. Number one, make sure that you've read through your annual notice of change. You're supposed to receive that by October 1, but I'm telling you, we've had tons of calls from people saying they did not receive it. So if you did not receive your annual notice of change that was supposed to be in your mailbox by October 1st, be sure to call the carrier, the insurance company that you have, and the customer service line on the back, and they should give you some direction, some way to access that either online or commit to mailing you a new one. So go through the annual notice of change because everything that's changing, they're going to disclose that to you. And take the time then to compare. That would be the second thing I'd say about this issue. And again, if you're our client, we certainly are facilitating that. If you're not, we'd be happy for you to call into our office and set up an appointment. So what we can do is we can help people to make sure they're going to be on the right Advantage plans. Now, the way we do that, we do have to have some vital information. We have an intake form that is required, and that way we know your docs, your meds, and we can do all the pre-planning prior to our personal appointments. So again, mistake number one, don't assume that you're going to be happy. And I've talked to several people already who told me, well, I guess it's fine, no major changes, but be sure you've looked at every single detail. That's a mistake. Number two mistake is this. If you are on a Medicare supplemental plan right now, And I think those of you who know me well know that I like supplemental plans in most situations. But if you're on a Medicare supplemental plan and that thing continues to increase where it's becoming unaffordable, you just simply cannot afford it anymore. And some of you, that may be the case, especially if you're on F plans. And if those are becoming unaffordable for you, what I would do is I would seriously look at an Advantage plan. I love SUPs, but if it's not affordable and it's making your budget so extremely tight, then I would, if it were me, I'd go ahead and look at an Advantage plan. And the mistake is missing this opportunity, because when we're on a supplemental plan and we want to move to a Medicare Advantage plan, this period of time is the only time of the year that you can make that move. And that's it. So that would be October 15th through December 7th. And again, if you'll give us your information with docs and meds and all that, we are happy to facilitate that. All right. And so be sure you know that we will assist that. And so Medicare does have another open enrollment season, which is the first quarter of the year, but that is not for you who are already on Med Sups wanting to switch to Advantage plan. That period of time is called the Medicare OEP, Open Enrollment Period, and that's for people that are already on Advantage plans. Then they can switch their Advantage plans if they own one as of January 1. So just know that if you're moving SUP to Advantage, this is the 7 weeks that you must do that, and don't miss that opportunity. Now again, you're mindful that if you do move from a SUP to Advantage, that system works differently. You're going to have to adjust to network providers. Your Med Sup plan, you can go anywhere you want that takes Medicare. So if you do move to Medicare Advantage, know that we're going to have to take the time to make sure your doctors and your hospitals that you prefer to see are going to be covered within the network. You are going to have some pre-authorizations from time to time on your Medicare Advantage plan that you didn't experience with the supplemental plan. But that's just part of that process. And then every year you're going to have to make sure you're on the plan, because they're not lifetime. They're just simply annual plans. And so again, it is a different system. But if you can't afford to be in that Med Sup system, then I wouldn't impose yourself, put upon yourself, some kind of financial hardship just to maintain that. And so, again, don't miss that opportunity. So that's mistake number 2. Mistake number 3, and that's this. If you decide that you are going to move to a Medicare Advantage plan this year, or you're going to switch to a Medicare Advantage plan that is advertising the give back. The give back. And by the way, I did a long form video on that today. It's got to go through edit and it'll come out here pretty soon. But the give back programs, folks, they are legitimate. I know you'll hear the ads and you'll think, well, how on earth can that happen? How can they increase my Social Security check? How can they decrease my Part B premium? And the reason that's possible is because what happens, the Medicare Advantage system is funded through what we call capitation. And capitation means that when you're on a Medicare Advantage plan, the Medicare Medicare doesn't pay any more bills. They don't pay providers. They actually give a fixed amount to the insurance company, and that's per member per month. And so that averages anywhere from $1,000, and it can get as high as $3,000. There's a base rate, but if people are really unhealthy, then Advantage Company gets more money. So again, they get about $1,000 to $3,000 a month. And so what they do is they take that money they get and they put together a managed care plan. That's the Advantage plan that has coverage for inpatient, outpatient, prescription drugs. You'll have some co-pays, but they put this whole plan together based upon the money they get. And so what happens, if they're going to give you a give back, they're going to give you money back, what they're doing is they're just readjusting some of those numbers. They're designing that plan differently. And just know, if you take that give back, and again, some of them are maybe $1,000 for the year, it could be $70, $80 a month, some are very, very high. But if you're getting that give back, you need to pay attention. What is it really costing me? You feel like you're getting a Social Security increase, and that is true, but it's also costing you something because they're readjusting that Medicare Advantage plan. I've looked at several of these already for 2026. If you didn't have a give back, you may have a plan that has a $4,000 max out of pocket. But with that give back, and they give you $1,000 back a year, you may have an $8,000 or $9,000 max out of pocket. So again, insurance companies are not benevolent. They're good at marketing, and they're just repackaging that Advantage plan. Now, I'm not saying you shouldn't do it. I'm just saying make sure you understand what it is costing you in benefits to take that Part B give back. Because I guarantee you are going to have a higher max out of pocket. Your specialist copays and hospital copays are definitely going to be higher. Some of the add-on benefits, such as dental, the vision, all those are definitely going to be reduced drastically. And so there is a cost to you to get that Part B give back. Now, if you say, hey, Marvin, it's the only way I can do it, I have to have that maximum amount, and you're willing to live with really that lesser quality of an Advantage plan because of the give back, then that's fine. That's, of course, your decision. But I just want to make sure you know there is a cost to you. There really is, and that's less of a quality of an Advantage plan whenever you're going to get a give back. Now, the exception to that would be if you can and are getting your medications through the VA, you're retired military and you have TRICARE insurance, or you're retired civil service and you have FEHB, or you have a union plan or employer plan, then what happens is you have a place to get your medications beyond the Part D system. That's credible coverage. So that's VA, TRICARE, FEHB, union plans, employer plans. Those are all credible. So if you're going to be on a Advantage plan and you take what is called an MA only, meaning there is no prescription drug coverage as part of that package, it's just for inpatient and outpatient services, hospital and everything outpatient, you have good medical, but you get your drugs elsewhere, then those give back programs can be very attractive. We have a lot of TRICARE people, veterans, that take those. And with those, there's not as much as a decline in the benefits in those plans. Why? Because the companies don't have to cover your meds, so they're willing to take some of those capitation dollars and then give those back to you for your Part B. So I like those. But if it's just a normal Medicare Advantage plan, look at what it's really going to cost you. And if it's MA only plan, then again, I think those could be very favorable. Those are called Patriot plans, honor plans, and almost all the companies have those now. Okay. And so just want to be clear about that, because I know you're going to get bombarded with ads and agents talking about that. All right. Number 4 mistake would be this, and that is that if you're on an Advantage plan right now and you would prefer to get out of that system, okay, and you would like to return back to original Medicare, you can do that twice a year. You can do it now, October 15th through December 7th, and you could also do it the first quarter of every year. So the point is, we can get off Advantage and return back to original Medicare twice a year. But you certainly, when you return to original Medicare, you're not going to assume all the liability of the gaps. So you are going to want to get a supplemental plan if you make that move. We get off Advantage, we return to original Medicare, you want to get a supplemental plan. But keep this in mind. If you have been on that Advantage plan for a year, 3 years, 5 or 10 years, whatever, folks, remember, you are going to have to go through underwriting. So you're not going to cancel that Advantage plan. What you would do is you would apply for a supplemental plan, keep your Advantage plan in place, and then apply for a supplemental plan, and we'd be happy to facilitate that. And then we go through the underwriting process to make sure that we can get you approved. So one mistake is canceling the Advantage plan. Don't do that. Just go through underwriting. And then if you get approved, then what happens is you have to pick out a standalone prescription drug plan. Your Advantage was inpatient, outpatient, and meds all in one. But now you return back to original Medicare and get a supplemental plan. That supplemental plan is going to fill in the gaps, but now we have to get a separate drug plan. And so you have to pay attention to the detail of that, because once you have then selected the right Part D plan, then what will happen is that Part D plan, once we've done the enrollment, it will kick out your Advantage plan effective 1/1 of 2026. So let me say it again. You're on an Advantage plan. You've been on it a year plus. We got to go through underwriting. So we don't cancel Advantage. We apply for the supplemental plan. If you get approved, now we pick out a drug plan, and then that will cancel it out. But that timeline all has to be done within that December 7th timeline, because that new drug plan then will kick out your Advantage plan. So it's a process. It's quite involved. So let's say you apply for a sup and you don't get approved. No harm done. Your Advantage plan wasn't canceled. So then you're back to doing your due diligence to make sure you're on the right Advantage plan for 2026. Okay. All right. Let me just mention one more, and this has to do actually kind of two items here, but it has to do with Part D plans. Part D plans. There can be some confusion on the max out of pocket for Part D plans. That number is changing a little bit into 2026. This year, that number is $2,000 for the year. Max out of pocket for medications on all Part D plans, whether that's embedded with the Advantage or it's a standalone Part D plan. Next year, that's going to $2,100, so it went up 5%. And so what people don't oftentimes realize is what's included in the $2,100 max. It is your deductible if you have to meet that, and it is all your co-pays and your co-insurance for the prescriptions that you pay for that you run through the plan, meaning they were in the formulary. So the $2,100 max is legitimate. It's a wonderful benefit. But again, that $2,100 max does not include your premium you're paying for the plan. It includes deductible co-pays, co-insurance up to the $2,100 as long as the medication is in formulary. And that's why the most important decision on a drug plan is the formulary. Make sure your medications are covered. Okay, why? Because in all meds that are covered, once you've spent $2,100 out of your pocket, you're done. The plan will pay 100% of the cost for the remainder of the year. Okay, so that's very, very critical. Now, in addition to this whole max out of pocket, I want to remind you, some of you this year are going to be tempted to not have a drug plan. That is a huge mistake. Please. I know that there are times when you can get your medications using a GoodRx coupon, maybe the Single Care discount platform, or Kuban's a Cost Plus drug plan. I know those are out there, and those are wonderful, and I encourage you to use those. But those are not equivalent to Part D plans. You can get your meds cheaper sometimes than a plan, but you get a drug plan because if your health were to change and you need an expensive medication, folks, I'm telling you, if you have a brand name medication, you may get a $35 reduction through GoodRx or Single Care. You're not going to get some big discount. It's not going to happen at all. And so that's where the benefit of having a Part D plan comes into play, because you may have to meet a deductible on a Part D plan, but then your co-payments are going to be, your co-pays are going to be very reasonable, and then we may hit the max of $2,100. So please get a drug plan. And just because there's been a lot of disruption, folks, there's still some very low-cost drug plans out there. So if you take very few meds or no meds, again, you can run them through the discount platforms, but still get some form of a Part D plan. Now, I've repeated this, but I'm going to share it again just so you know. We're nationwide brokers, okay? We look at, every state, we can take care of you. I did a kind of a deep dive into the 2026 drug plans just where I live. I just wanted to look at them. There were 12 plans. 12 plans, folks. 6 of those plans, of the 6, there was one that was $15.50 a month, and everything else of those 6 plans was less. So from 0 to $15.50, half of the plans were in the very low cost range. And then we had 3 plans that were between $50 and $80, premium monthly. And then we had 3 that were above $100. Okay, so half of them were kind of a higher premium, the other half were not. So my point is, there will be plans out there this year that are going to be very low cost. But if you're taking expensive medications, you may need to pay that $60 or $70 premium or that $100 premium to get your medications covered. I'd much rather pay more of a premium, get my meds covered, that way everything's included in the $2,100 cap, than get some cheap drug plan where my meds aren't covered. Okay, it's better to pay the premium. It really, really is. Okay, now, another aspect about this, folks, listen, when you go on a drug plan, please just live in the present. Whatever meds you're taking out, don't worry about what you're going to take in 2 and 3 years, because medication plans can be changed every year. So what you take now, if there's a probability that doc may put you on something, then include that in your medication list. But it's nothing, if you're not taking it now, just let's stay current with what you're taking, find the best drug plan for 2026. And remember, this is the only time you have to do it, 7 weeks. So don't procrastinate that. Don't put that off. Be sure to get on the right prescription drug plan. All right. So those are some of the common mistakes I want you to avoid. And so to my team, I want you to know I'm ready. Let's start taking questions, and I'll go just as long as I possibly can. All right. Here we go. How do you compare formularies for overall quality and comprehensiveness other than by drugs currently prescribed? I worry a low-cost plan is luring me with a low-quality formulary. Okay, well, here's what you could do. If you want to look, what I would do if I were in your position, go ahead in the platforms. That could be Medicare.gov. If you're our client, it's MedicareSchoolEnroll.com. But go to the platform and go ahead and put your medications in and look at the plans. And then go back and then add some things just for curiosity's sake. If I were doing it, I would probably add Eliquis. Put Eliquis in. Eliquis is a blood thinner. It's a patented blood thinner. Or Xarelto, that would be a good one to put in there as well. Again, those are more expensive meds. And see what kind of coverage you have with that. See if you have a flat copay, or see if there's a plan that you have to pay like 25% co-insurance. So put some meds in there. You may want to put in Ozempic. And I know you're not probably on Ozempic. I'm saying if you really want to know the quality, then put in Ozempic, because that's a very costly medication. I just ran it the other day, and this guy's dosage was $1,000 his first fill. And so just if you want to put in a few meds that you know they're going to be more expensive, you could put in Stelara, Stelara. I think it is Stelara. I think it's for psoriatic arthritis, Crohn's disease, those autoimmune things. Very expensive. See if it's going to be a covered medication. Let me tell you this quick story. I talked with a couple yesterday. They've been my clients for years, and the gentleman was on 7 medications. 7. And again, he was in the Kansas City metro area. And so I looked at those plans. I've already told you how many there were. And of all the plans, there was only one plan that would cover all 7 of his prescriptions. He had a very kind of a newer brand name kidney medication. In fact, I had never even heard of it, and I've been doing this a long time. It was new to me. And so I put it in, and all the plans covered 6 of the 7 meds, but not that kidney medication. So we had one plan that would cover all of them. So of course, that's the plan that he's going to enroll into this year, because it gets all of his meds covered, and we get the benefit of that cap. So that's what I would do. Go to the platform, shop at just your meds, and then go back in and add a few brand name medications, and you're going to find out then the quality of that plan. All right, let's keep going. All right, we always read that MA plans are more popular than subs. How much of that is caused by underwriting requirements past initial IEP? Well, I will tell you, I think there could be some, that could have some effect. But the reason they're more popular is primarily because the monthly premiums. So there are plenty of people that can't afford a sup or don't want to afford a sup, meaning they just simply don't want to pay a premium. Now, in my view, when we get a supplemental plan, and I'm going to have one I start in January, I think we get a lot for our money. It's not like, we're getting ripped off. It's not like they're overcharging us. We get the ability to go to any doctor that takes Medicare. We don't have to deal with pre-authorizations from the insurance company. I know Medicare has a few. We get a permanent policy that's portable, and on it goes, all the benefits. So you pay for that, and I'm willing to pay for that. And some people can't afford it, or they just don't want to. They just don't think it's important. And so that really is why the Medicare Advantage plans tend to be more popular. I don't think it's because of the beyond your initial time. Now, this is going to affect some for sure, but the majority of people that are starting Medicare during their IEP that have health problems, they're getting supplemental plans because they know this could be their one and only opportunity to get one. And so I think that's the primary reason. I think it's a money issue. And also I think, folks, it's because agents push them like crazy. I've told you all before, listen, we get paid twice the commission initially on an Advantage versus a sup. We make twice as much money. That's a lot. That's a big difference. If someone's chasing commissions, they're going to really promote Advantage plans, so they're promoted. You see all the ads. How many ads are you going to see this year about supplemental plans? Very, very few. You'll see plenty of ads about Advantage plans. Why? Because insurance companies make a tremendous amount of money off those. And so agents are financially incentivized to sell Advantage plans. And by the way, hey, we're not at all. Our agents, whether you get a sup or you get an Advantage, I promise you, we pay them the same. We do not incentivize them. That would be wrong to do that. And we don't do that at all. But I think those are some of the contributing factors, not just the one that you mentioned about having to go through underwriting after the IEP. But it's still part of it. I'm not saying that. I don't think it's the biggest part, though. All right, next. All right, rate increases getting higher. What amount of increase suggests I should shop rates? $5, $10, $15. Okay, well, my kind of rule of thumb is that $20 for sure. if you can shop and you can move to another carrier and you can save $20, $25, $30, folks, I would be moving. And it's really simple to shop, especially if you're our client. We've got some great sites that you can go to where you can actually look even without our involvement. And one of them, we got a couple of them. One of them is MedigapCompare.com. Medigapcompare.com, and we own that site. You can go there, and what it does, it'll look at the lowest three national carriers in your market. Now, there's a lot of carriers in that platform, but we just give you the lowest three. And so you can see if you can get a better rate. And you actually can look at some of the health questions, and through that system, reach out to us and we'll set up an appointment for you. So if you can save $20, I'd be making a move, because not only am I saving that $20 a month or more, I'm also resetting the clock. Because if you're 67, 70 years old, whatever, you've been in a group that's shrinking because people pass away and people get off plans. And so by moving and switching that plan, now you're starting again, you're starting over in a new block of business that'll probably be larger, and that will be also by average younger. And so I think it's good to switch. Now, $5 or $10, I probably wouldn't do it, but I'd be checking next year then. And we encourage our clients, check these things out every 3 years or so, just to make sure that you're getting the best price. Okay, hope that helped. Let's keep going. When signing up for Part D on your site, are we able to select mail order when we enroll, or is that done online? Now, what you can do on our site is you can look at the mail order prices. You can put 3 different retail pharmacies on our site, and then also mail order will be available. But you're not signing up for mail order. You're just looking at what it will cost to use mail order. So here's what happens. When that company sends you the new card, for your plan, then they will show you how you can order your prescriptions through their mail order. All right, and so then they'll facilitate that for you, but it's not, you can't do that, folks. The way to look at these sites, including Medicare.gov, these are just places where you can shop and compare plans. Okay, so look at our site the same way. Anyway, so hope that helps. But again, you'll know the price, but you have to enroll separately. All right, I'm starting my retirement this December and I already made a plan through MedicareSchool.com to join WellCare Value Script. Good for me and my spouse, Part D. Am I set for 2026 also? Just leave it. Okay, now, not necessarily. I would say high probability. I've written lots of business already where we're starting people November, December on 2025 WellCare plans, and then the 2026 plan is also going to be in their best interest. But do me a favor, it's still wise to check. And so again, go to our live event at 2:00 every day, liverxhelp.com. If you're unfamiliar with how to use that, I guarantee you, when we set you up, we set you up on an account. You have a username, which is probably an email address, and you have a password. And you can go in there, put your zip code in, and you can look at the 2026 plans. And more than likely, WellCare Value Script is going to be at the top, at least top 1 or 2. But I will tell you this, had a guy the other day that was on WellCare Value Script. 2025, the premium was 50 cents a month. His plan in 2026 jumped up to, I think it was like $9.80 or something like that. Still very attractive, but from 50 cents to almost $10, that's a sizable jump, really, percentage-wise. And he wasn't aware of it because he just assumed it was still going to be the best plan. So all I'm saying, more than likely, it will be best for you for 2026, but please make sure on that. If it still is best, you have to do nothing because that plan will automatically renew. But if it's not the best, then that new enrollment for 2026 done at this time of the year will kick out that WellCare Value Script on 12/31, and your new plan would go into effect January 1st. Okay, and it won't take that long to check that out. So please do so. All right, Gerald, why is there a huge price difference between Plan G companies, and then why choose a lower cost versus a higher cost? Okay, so confusing. Hey, Gerald, let me give you an illustration about insurance. You probably own a home. I own my own home, and just recently, a few months ago, I decided that I wanted to shop for my homeowner's policy. I've had the same one for, I don't know, 4 years or so, and I just wanted to make sure. And so what I did is, of course, my home, it's a nice home. It's in an older neighborhood that, people take good care of their properties. And so I have a roof that's fairly new, so many square foot and all that. And so I took my home and I gave all the details to insurance companies. I checked several, and I won't name them off, but lots of them you would know, State Farm and Allstate and Geico and a couple others. And so I shopped it. Same house, same condition, same age of the roof, everything else, same square footage, and every single one of those companies gave me a different price. Okay? Every one of them. There was none that were same. That's the same way it is with supplemental plans. The coverage is the same because Medicare standardizes it, just like my house is the same. But you have insurance companies that set the prices. And even like in homeowners or in auto policies, you have actuaries that come up with these numbers based upon what profit margins they are trying to make, based upon markets that they may be aggressive in. So there's a lot of variables, claims history, a lot of things go into that. And the same thing is true with med sup plans. Same coverage, different rates. And I know that's annoying for sure. And so the bottom line is, though, we don't just necessarily, always go with the lowest, though sometimes we can, and that's a good move. It really is, as long as that company is proven to be stable. No agent can predict future rates, but we can look back at previous rates and previous rate history and stability. So we like to do that before we make a final decision. So sometimes the lowest rate is a very stable company, then I'd be all over that. But if it's with a company that's new to the market, we're questionable, we're not sure, then I may take the next lowest or a third lowest or whatever. But there's a lot that goes into that decision, not just lowest initial premium. Okay. I hope that answered your question. Let's keep going. All right, I went through Medicare school 2 years ago, and I cannot say enough for the help provided. Just called, and they help you on every aspect and took the stress away. All right, well, thank you very much, Carolyn. We appreciate the words of encouragement, and thank you very much. All right, any tips for someone who's recently approved for disability under 65 to learn what choices are available for Medicare? Yes, call us. We write in all 50 states. Now, let me just give you a couple tips. Here's the way it works in the Medicare world. There's federal laws, and then there are different or differing state laws. Everyone has to have plans that follow the federal laws, but if the state insurance commissioner says, no, we're going to have some additional laws, meaning more favorable for the consumer, that also can happen. Now, there is one law and one rule that I'm going to share with you about coming into disability under 65. And by the way, those of you that are watching, I'll tell you how this works. If someone gets approved for Social Security disability, on the 25th month of having received Social Security disability checks, they're enrolled into Medicare A and B automatically. Their A and B starts on the 25th month, regardless of age. Also, someone that has permanent kidney failure, they're on dialysis, that's called end-stage renal disease, or they have Lou Gehrig's disease, they also begin Medicare, not on the 25th month, they begin Medicare immediately. All right, that's Lou Gehrig's, permanent kidney failure, Social Security, 25th month. All right, so we have people that are not 65 that are already on Medicare. The federal law says this, that states, insurance companies that write in states are not required to offer Medicare supplemental plans, okay? And most of the states follow that rule. You cannot get a Medicare supplemental plan under age 65 because federal law is followed by most states. Now, there are some states that say to the insurance companies, we will leave it up to you. If you want to, you can do it. But the problem with that is when they leave it up to insurance companies, many times the premiums are very high, and sometimes people can't afford an underage supplemental policy. Now, other states say, no, you have to write them, you've got to make them available, and you can charge a little extra. Some say, yes, you have to make them available, and you can't charge them any extra. They get a regular 65-year-old rate. So again, there's a variety of rules, differing rules based upon the state. But again, federal law, they're not required. I'll just give you an example. In Texas right now, you cannot, underage, get a Medicare supplemental plan in Texas. You can't. You have one option, and that is to take an Advantage plan. But here's the good news in Texas and most other states. Even if you do have to get on Advantage plan, it's still, in my opinion, tons better than having A and B only. Because with A and B only, folks, remember, you have no stop loss limit. You have no stopping. It's going and going and going financially. So at least the Advantage plan is going to have a max out of pocket. So I like that. And then what happens once you approach your 65th birth month? Let's just say you're on Medicare at 61 because of disability. 4 years later, as you approach your 65th birthday, you are now going to have what we call the IEP2, the second opportunity for you to get into Medicare, and then you fall underneath just the normal rules of someone turning 65. You can get any supplemental plan you want that's sold in your state, any carrier, and there's no underwriting involved. So even if you can only get an Advantage because you live in a state that does not require it, then you still will be able to reset the clock at age 65. Okay? So that's my tips for you. Okay, could you review SAP again, please? Newbie to Medicare. SAP. Do you mean SEP? I think you mean SEP. Hey, my team, am I missing something here? Could you review SAP again, please? Newbie to Medicare here. Okay, I'm going to assume SEP. So what happens is this. When a person goes on Medicare, and as long as they, by the way, have 40 quarters of Medicare taxes paid into the system, which is 10 years worth of work, then they're eligible for Medicare at 65. And some people will start Medicare at 65, but you don't have to if you or your spouse are still working, and you're on a group plan that has 20 employees or more on the payroll. Okay, so there's some people that have to start Medicare at 65, and there's one group that doesn't. And so the group that doesn't, again, still working, or your spouse is covered by a group plan, 20 or more employees on the payroll. You don't have to do anything with Medicare A, you don't have to do B. So if you come in at a later date because you keep working, let's say you come in at 67, that is called the SEP. That stands for a Special Enrollment Period. And this is a different enrollment period to come into Medicare, because if I start at 65, that enrollment period is called the IEP, Initial Enrollment Period, and that lasts only for 7 months. So if I don't exercise my right during that 7 months, I can still come into Medicare later, and in the future, as long as, again, I was covered by a group plan, mine or my spouse's. All right. And so that process is called special enrollment. We have to verify credible coverage. We do that with a form called an L564, and then we pick the date that we want to start. That's called the CMS 40B. And those two forms are not necessary in an IEP, but always necessary during an SEP. And so those are submitted. By the way, you work with us, we'll do all this for you and with you, but you have to have your HR fill out the L564, we'll fill out the 40B, and then you have to submit those to a local Social Security office to come into Medicare. No penalties, no problems. That's the SEP. And for people that mess all this up, miss the IEP, mess up their SEP or don't have one, then there's a third enrollment period called the General Enrollment Period. You don't want to have to use this one, but it's still there. And the General Enrollment Period is the first quarter of every year. Anyone that has 40 quarters that didn't come in an IEP, didn't come in an SEP, can enroll the first 3 months of the year. Now, when you do that, sometimes there can be penalties, but that's the third opportunity we have to come into Medicare. The problem is it's only the first 3 months. So if a person makes a mistake or they miss an enrollment period and they realize that in April, it's too late. Now they're going to go without Medicare for the rest of the year, and then in January the following year, they can enroll into Medicare and start in February. Okay, so hopefully that helps. And by the way, go to our website, medicareschool.com, and there's a 50-minute workshop where I really get into all the kind of the ABCs of Medicare, and it really is thorough. It's 50 minutes long. It's called the Essentials Workshop. It's at medicareschool.com, that workshop. And then also we have a YouTube channel. And you can go there, and of course, there's probably 500 videos on our YouTube channel now that we've done over the last many years, and you can learn a lot that way as well. All right, enough of that. Let's keep going. During the enrollment period, is it true that you can switch from original Medicare to Advantage plan without going through underwriting? It is true. It is true. One time of the year, you can do this, and that's October 15th through December 7th. If you only had original, which means you only had A and B, you can select an Advantage plan during this time of the year, open enrollment, the annual enrollment period, 7 weeks, and then that Advantage plan then would go into effect January 1. And there is never underwriting on Advantage plans. Part of the whole Advantage program when they started it back in basically in the late 90s, and it got really rolling in 2003. They said to the insurance companies, you have to take everyone. Now, they used to be able to decline people that had permanent kidney failure, but that's gone now. So there's no underwriting for anything. If you want the Advantage, you can do it, but you can only add it at this time of the year, today through December 7th. Call us. We'd love to help you with that. Okay, if you're on Medicare, can you receive drug assistance from a pharmaceutical company for a very expensive drug injection? Yes, you can. If you get approved for that, then that manufactured assistance is available. Now, here's what can be different, though, folks. There are some times when you're on a group plan and you're on a certain brand name medication, you get one of those copay cards. And it's not uncommon for those copay cards to be void once you go on Medicare. And again, that's not the same thing that this person just asked. I just want to clarify that. Usually the copay cards are gone. But if you go directly to the manufacturer and you get approved for that, then yes, that can happen while you're still on a Part D plan. It'll be separate coverage for sure. All right, great question. Let's keep going. Okay. If I will hit the max out of pocket, $2,100, am I correct that the only concern is the premium and formulary since the deductible will hit no matter what? Well, you're close. Yeah, your only concern is premium formulary. That's the main thing that's going to matter. Since the deductible I will hit no matter what. So the reason I'm saying not exactly, because some plans don't have a deductible. And usually the plans that are going to be pushing that $80 to $100, $110 monthly premium oftentimes will waive the deductible because they're really collecting that deductible in the premium. And so let's clarify, what's in the $2,100? It is deductible if it's applicable. And all your copays, which are 25% coinsurance, up until you hit the max. Okay, so you're right. Premium matters, formulary matters, but deductible is not always a part of that package. Most times it is, but sometimes not. That's all. Let's keep going. All right, 65 wife, 63. I have employer health insurance well in excess of 20 employees. However, I pay $360 per week. Oh boy, yeah, that's a lot. Okay, so here's what I would see. Must I wait until she turns 65? Not necessarily. What you could do, you could find out through the healthcare exchange what options you have for her. For sure, you could do that. And find out the premiums that would cost you. Now, that whole market is kind of upside down right now. We're waiting to see if those COVID subsidies are going to continue on. That's the whole issue with the government shutdown right now. Another option you have that you could look into, listen, this is a little bit, it's not tricky, but can be confusing. If you're still working and you choose to go on Medicare, then your spouse would have eligibility of COBRA for 36 months. A lot of people think that COBRA only goes 18 months. That's not true. Sometimes it's 18 months, sometimes it's 29 months, sometimes it's actually 36 months. And so when a person that's still working goes on Medicare, that gives an eligibility of COBRA for your spouse for 36 months. Now, your spouse didn't need that, but it looks like because they're 63, they may need more. They may need more than the 18 months. So what I would check into is if you were to go on Medicare, what would be your premium for COBRA? Now, it may be crazy high, and this may not even be an option for you, but I would definitely check that out first. Because again, minimum 18 months, it could be longer than that for sure if you make the move to Medicare. All right, so I'd look at that. I'd look at the exchange. And then beyond that, and again, there may be some new plans come out this year when this new season starts. Just because if these subsidies do go away, I think the market's going to respond with some other alternatives, and you may find that you're comfortable with those alternatives. $360 a week, so what is that? $720. That's $1,440 a month. And so now, if you're real high income, Medicare still may not make sense. But if you're, at those thresholds, married filing a joint return below $212,000 or below, let's say, $260,000, you may have a slight IRMA, but you can get a good package for yourself for around $350 to $400, and I'm talking about Cadillac coverage. And so you're spending right now $1,440, so that gives you an extra $1,000 there. So you still may just have to continue to bite the bullet, but that's the things I would at least look into: healthcare exchange, what's the cost of Cobra, and then take it from there. And we'd be happy to guide you through the process if you want to call us. Okay, let's keep going. Who's next? Okay, staying on commercial insurance is an option through work, but if turning 65, I would have to register anyway, right? No. You don't have to do anything as long as your employer has 20 employees on the payroll. You don't have to register for anything. You don't have to call them, tell them nothing. Now, listen, if you are going to stay in a group plan and it does not have an HSA option, a health savings account option that you're contributing to, what I would do if I were you is I would enroll into Medicare A only. 99% of all people get Medicare A only at zero premium. Why? We fund it all of our working life. You realize that 1.45% that you pay and your employer matches, that's actually going into the hospital trust fund. And so as long as we paid into Part A, Medicare taxes for at least 10 years, 40 quarters, then we get Part A at zero premium. And so there's no cost. And so as long as you don't have an HSA, I would enroll in A only. Now, what's going to happen on your large group if you went to the hospital, because that's what A is for, your group plan is going to pay first and Medicare is going to pay second. If we have an employer that's small, 19 or less, it's just the opposite. Medicare pays first, small employer pays second. But in your scenario, Medicare is going to be the second payer. And here's the way it works. If you went to the hospital, your group plan pays first. Medicare in the second payer position will not pay any copays, it will not pay any deductibles, but it will pay coinsurance. And so most people have coinsurance responsibility on a hospitalization. Coinsurance is that 80, 20, 90, 10. You pay the 10 or 20%. Medicare will participate in that. That's why I like A only. But I wouldn't enroll in anything, A or B, if you're going to keep working and have an HSA. If you're maxing that HSA, I would say do nothing. You won't be penalized, I promise. As long as A is zero premium, it's always zero. And keep putting money into that HSA. HSAs, health savings accounts, are like healthcare IRAs. They're wonderful. Put the money in pre-tax. If it's an account that grows, it grows tax deferred. And if you use that money anytime during your life on medical, what they call qualified medical expenses, you never pay taxes on that money. So it's awesome. You can even convert it down the road and pull the money out. You have to, of course, pay the taxes on it. But anyway, so I like HSA. So do A only if you don't have an HSA. That's the only thing you need to do. So just enroll in that. It's simple. MySSA.gov account and take A only. Okay, not B. All right, let's keep going. How do I know if my Humana Value PPO for 2026 has a provider distance geographic limit? Where can I find in evidence of coverage? Okay, well, what I would do is I would go to the portal, and you'll have one. There would be a consumer portal with Humana, and you can actually do a provider search. So you're asking me, how do I know my Humana Value PPO has a provider distance? Well, what you would want to do is if it gives you the option to select 5 miles, 10 miles, whatever. But most of those that have some kind of a parameter, I think they go out like 100 miles. I mean, it's a long ways. So I would just put in there whatever distance you're comfortable driving, to a doctor or to a hospital, and that program should provide those. Now, listen, if you go out way out, you're probably going to get 3,000 doctors or whatever. We usually just find out the zip code and then we go out about 5 or 10 miles as a general search. But if you want to broaden that, you should be able to do that on Humana's portal for consumers. And if you're using our company and you want us to help you with this, reach out to us. We're happy to do that. We do that all day long. But if you're going to do it yourself, that's what I would recommend. All right, let's keep going. Isn't regular Medicare better than an Advantage plan? Well, if I had regular Medicare only, the answer to that is no. If I think A and B only is the worst option. And the reason for that is because you're fully responsible for all the gaps that exist in original Medicare. We call those gaps. I don't have time to go into all of them, but there's 6 of them. We have 3 gaps on the A and we have 3 gaps on the B. There's deductibles, there's copays, there's coinsurance, and there's excess charges. So that's a lot of money. So if A and B only, you're responsible for all those out of pocket. The only thing, folks, that Medicare covers 100% is preventive services. That's it. So you're always going to have a balance. So if I have A and B only, that is way, way too risky. The reason I think an Advantage plan is better than A and B only is because the Advantage plan is going to have some reasonable copays and a max out of pocket for the year. So I'm not at risk for $50,000, $100,000. I'm at risk for maybe $5,000 for the whole year. Now, I still think the very best, if a person can afford it, is to be an original Medicare A and B, but then get a supplemental plan, either a G plan or an N plan, to fill in those financial gaps. Now, to me, that's the best because of all the benefits that come with that original Medicare system. Again, go to any provider that takes Medicare. It's a permanent policy. It's lifetime, portable. You don't lose those policies. If I pull out my card in Alaska or I pull out my cards in Florida, everyone knows how the system works. So I still prefer that, but not everyone wants to afford that or can afford that, and so they can't do that or won't do that. So I would rate them as A and B only would be my last choice. Advantage is better than A and B only, and then I think supplemental plan is still better. And by the way, those of you who are on Advantage plans, I hope you have a good experience. I'm not trying to badmouth those plans. We just try to be honest about how they work. It's a different system, and you need to understand that. And why is it that people pay a premium for a supplemental plan? There's a good reason they do it. But again, if they can afford it. And if not, let's find you an Advantage plan, and you should be well taken care of. Okay, I think supplemental plans are exceptional, and I think that Advantage plans are still very, very, very adequate insurance. Okay, they just are. A and B only, too risky, in my opinion. All right, let's keep going. Vermont is dropping many Medicare Advantage plans, and so are lots of other states. Do you know what Advantage plans are staying in Vermont? Last year, WellCare dropped Vermont, and that was a huge insurer for Rutland County in Vermont. Okay, well, what I would encourage you to do if you want, we write business in Vermont. We write in all 50 states, so I cannot rattle off the top of my head exactly what's being offered there. But our agents know, and so if you want to call in, you can call in and let's see what's available in your market for sure. My understanding is this. I just read this recently. We know that over 2 million people are going to lose their Advantage plans. 2 million. But 99% of those people that are losing their Advantage plan are going to have some Advantage plan option in their market. Okay, so only 1% have nothing. They're going to have to, go back to original Medicare and get a supplemental plan if they can afford it. So there still should be, some options that are available. Yeah. And what's unfortunate, you all, about this whole thing, these Advantage plans, the name of the game for years has just been enroll members and, just grow, their membership rolls. And that changed this year. These companies are not going to be in markets where they're not profitable. They would lose money, and but other markets, they would make money. So they'd use the wins to offset the losses. And now they're done with that. If it's a losing market, they're dropping out. And that's why 2 million people are losing their coverage. They're just not going to be in markets where they can't make a profit any longer. And the government gives them the right to do that because, again, Advantage plans are only 1 year at a time. That's one of the issues with them. They can improve the plan, decrease the plan. They can pull the plan because that's the way Advantage are. They're just 1 year at a time. Contract between Medicare, insurance company, and you. And when you enroll in that system, again, you get what you pay for. And so if you have a zero premium, there's a reason for that. There's a few strings attached to that zero premium plan. Okay? All right. Let's keep going. I'm eligible for Medicare in May 2026. Unfortunately, I'll be subject to IRMA due to my, okay, good. My question is IRMA permanent or does it adjust year to year? Yeah, it changes every year. So here's what happens. For those of you that don't know what this person's talking about, an IRMA is an acronym that stands for Income-Related Monthly Adjustment Amounts. And this is applicable to about 15% of the population. 85% of you will not have an IRMA because you're at the income threshold or below where there is no IRMA charged. This year, a single filer, that threshold is $106,000. Married filing a joint return, it is $212,000. Now, if you're married filing a separate return, there's a different number. Head of household, there's a different number. But for single people, 106 below, married people, $212,000 below. Each of you would just pay the base premium, $185 this year. year. We don't know what it's going to be next year. They're saying somewhere around maybe 206.50. That number's not out yet. But what happens is they set these income thresholds. So if I stay below it, I don't have an IRMA. If I'm above those thresholds, we have 5 different levels of IRMAs. And basically they're from about $88 a month upwards to about $525 a month. Okay, and so these additional surcharges then are attached to the Medicare Part B premiums and the Medicare drug plan. And so in order to determine if people have IRMAs, they put out new numbers every year. So they give us the thresholds. And so those thresholds will go up a little bit. Again, we don't know what they're going to be. Single right now, 106, 212. Next year, probably 110, 112 maybe, and doubled then for couples. And so, again, they'll look back at 2024. And so what happens is these numbers come out every year. So the IRMAs go up a little bit as well beyond the thresholds. And so in order to establish how much you pay for your Part B premium, they always look back 2 years at your modified adjusted gross income. So this year, they have been looking at 2023. In 2026, they're going to look back at 2024. Obviously, this year is going to matter in 2027. But here's the good news. Sometimes people have high income because of their jobs or salaries, commissions. But when they have a life-changing event, then their numbers are not the same. So we actually can appeal the IRMAs. So they look back 2 years, but if I retire this year or last and I'm not making that kind of money, I can fill out a form called an SS-44 and I can say, I want to give you different numbers because I have a life-changing event. Those life-changing events, there's 8 of them. Death, divorce, marriage, work stoppage, work reduction, loss of income producing property, loss of a pension plan, or loss of an employment settlement agreement. Those are the 8. And by the way, you can find all this on the SS-44 form. Okay, so that's kind of a brief education there about IRMAs. And so, by the way, sir or ma'am, whoever wrote in on this one, if you have an IRMA, I know it's not pleasant, but it is a great problem to have. That means you're high income. But again, if the income changes because of a life-changing event, then certainly take the time to appeal it. You work with us. We'll do all that with you and for you. All right, let's keep going. Okay, will my income not affect the cost of Parts A and B? 67 months, Medicare costs me 3 times my... No, okay, your income will always affect your Part B. It has nothing to do with A. Okay, if my staff, could you keep that question up? Because when you take those away from me, I just need more time. So when will income affect? Not affect. So your income will always affect Part B. So you're saying 67 to 2 months, so Medicare cost me 3 times my plans before 65. Okay. 67 and 2 months. So I'm not sure. Okay, 3 times my plan. So yeah, and that's probably right. You must be at the highest IRMA because right now the base IRMA is 185, and that highest level for singles above 500,000, married filing a joint above 750,000. That's probably what you're paying. So again, yeah, that makes sense. But it's always going to matter. Now, if you have a life-changing event, one of the 8, and that affects your income, then you can appeal it, and then it wouldn't have an effect on it. But it will continue. If you continue to stay, hey, I've got a client that makes $1 million every year and will until he dies. He's always going to have the highest IRMA. And that's just the way it works. Okay, hope that helped. Let's keep going. All right, I just set up Medicare School, 66 8 months. I'm waiting until I turn 67 in February, okay, to start Social Security with a higher benefit. When should I submit my S? Okay, here's the way it works. You can submit your Social Security application 4 months prior to when you want to start your benefit. So let's say, let's say you say it turns in February. So if you want to start your benefits in February, which means you'll get your first check in March, because remember, Social Security payments are always 1 month in arrears. So if you want to start in February, let's back up the clock. January, December, November, October. So you can actually do that now, meaning that system is open for you. You can go in there, and what's going to happen is they're going to, as you go through the application, they're going to ask you, when do you want to start? And they will actually ask you, do you want to start? If you did it right now, they'd say, do you want to start in October? And if you don't want to, then you're going to say no, and then they're going you'll click no, and then they're going to give you a range of when you can actually start those benefits. Okay, and there'll be a few months range, and then you pick the month that you want to start. And then they're going to ask you why. What's the reason? And you may just want to say, because I'm waiting to 67. There is no right or wrong reason. They're just going to they want to know the reason. So that's part of the application. Okay, so that opens up for you. You can do it 4 months in advance. Now, for those of you that are going to go on Medicare, you actually can apply for Medicare self-enrollment 3 months in advance. So Social Security is 4, Medicare is 3. Now, for those of you that have been delaying for a while. Just helped a lady the other day with her Social Security. She's actually starting at age 70. And so what happens then, if you're starting basically 6 months beyond your full retirement age, what they'll do is they'll give you a chance to actually backdate 6 months. And so she did that. She elected to take that lump sum check. Now, again, she's going to lose a little bit because it's been growing at 0.67% a month. But sometimes people like that lump sum. Now, not everyone gets a backdate, folks. I'm just saying people that are going to start Social Security after their full retirement age, they will be given in their range of months to begin. They will backdate up to 6 months. Okay, and again, you're going to take a little less, but that lump sum check could be nice for you. All right, hope that helped. Let's keep going. My wife is turning 65. Blue Cross Blue Shield South Carolina is offering an Advantage plan with a guaranteed issue back to a Plan G anytime in the next 3 years. Okay, good. Thoughts on that option versus starting with a Plan G? Well, I will tell you, I think that's attractive. Now, while she's on that Advantage plan with the Blue Cross, she's still going to have to live within the guidelines of that. You're still going to have networks, pre-authorizations and such, but that's pretty attractive. So basically what they're doing with this plan is instead of giving someone a 1-year trial right, you have a 3-year trial right. And so, if you all are comfortable with the Advantage plan, at least you're not going to be stuck on that forever. I definitely, if it were me, I'd exercise that right within the 3-year period of time. So I don't think that's a bad deal. Now, I would say this: if your wife is unhealthy and having some health issues, I probably wouldn't want the exposure on the max out of pocket on an Advantage plan. I'd just soon be on a supplemental plan. Because think about this, folks. Listen, 1 day in the hospital on Advantage plan. Let me rephrase that. Let's say 4 days in the hospital. Not really 3 days. Usually 3 days in the hospital on Advantage plan. If it's about $400 a day, sometimes they're 5. So 3 or 4 days in the hospital, just one event in that year is equivalent to your annual premium on a supplemental plan. In plan, G plan. So the whole point is one hospitalization. Copays on Advantage usually will exceed your annual cost on your supplemental plan. So my point to you, sir, is if your wife has health problems, she's still going to have to pay that daily copay. And so, but if she's healthy, I don't think that's a bad option at all. Okay. All right, let's keep going. Hope that helped. All right, Cigna is an Advantage plan. It is safe to keep it. And which plan go better with for a better copay? Okay, well, it is fine to keep Cigna. This year, of course, Cigna was purchased by Health Care Services Corporation, HCSC. They bought Cigna for, $3.5 billion or something like that, a lot. And so they're rebranding everything from Cigna to HealthSpring. And so hopefully you received your annual notice of change so you know what that plan is doing next year. And if you're still happy with that plan, there's no major changes, then it's fine. Let the plan automatically renew. I still would shop it if it were me. Just because there's so many changes this year, I would still look and see what else is out there that may be better in your market. And it may be that Cigna or HealthSpring is still going to be your best option, but it doesn't take long at all to make sure. And, people call us every day to do that. Call us. We're happy to spend a few minutes, pull up your zip code. Let's see about your docs and your meds and see if there may be something better on that plan. I like Cigna. I'm not, concerned about them at all, but it never hurts to compare. Okay. Next. I'm currently on a Medicare supplemental plan, Part D plan, and have issues trying to get the best price because of changes to the insurance coverages. Would your company be able to help me? Okay, I'm trying to get the best price because of changes. Okay. Well, we can definitely help you if we're your agent. So if you want to shop plans and get on a new Medicare supplemental plan, a different one, and we become your agent, then sure, we have our own customer service team. But if you're not our client and you need some customer service issue, we can't help you. because only the agent of record, that broker that actually wrote the policy, is able to assist you. And so if we are your agent of record, or we become that, if we do some switching, we'd be delighted. Not only set you up initially, with the right plan, but also moving forward. Our customer service team takes care of our people. So happy to help. All right, who's next? Is it acceptable to present a digital Medicare card and supplemental card on your phone at the doctor's office or hospital? Well, you know what? I don't know the answer to that question. So I am assuming when you say digital, I guess you mean that you have a copy of that maybe in an Apple Wallet or something, and a supplemental card. So I think it would really be up to the provider. We have people that lose their cards and have to reorder. So we know that they can still go to the doctor. They just simply give them their Medicare number, verbally. And the supplemental, policy number would still all be there. So I'm assuming that would work. You may go to a certain provider that says, no, we actually want to have that card so we can, make a copy of it and have it within our records. But just so you know, I'm not aware that there are digital cards available for subs or Medicare. Now, if you make one of your own by way of a picture or something, it may work. But again, I think I wouldn't depend upon that presently. I'd rather have those cards in my possession. If so, remember, folks, you can always laminate your Medicare card. I know they're paper, but you can laminate those. I don't think they like you to laminate your Social Security, but you can your Medicare card. So I personally would carry those. Okay. Sorry, I can't help beyond that. Just that's a new one on me. All right. Well, when an SAP for Part A and B starting February 1, 26, how long do I have to find a Part D and a Medigap plan? Okay, so what you're saying to me is that you're starting your B 2/1/2026. So the way it works is SEP means you're coming off an employer-provided plan. So once you have lost the employer-provided plan, you have 63 days to enroll into a drug plan. 63 days. Now, when it comes to Part B, what happens is your MedSup plan, you have 6 months from your B date to still get a supplemental plan with no underwriting. So technically, that would be counted all of February, March, April, May, June, and July. So from February 1 all the way to July 31, you can select the MedSup of your choice. Of course, you can't get a Medigap F or Medigap C, but you can get any of the others that are available in your area, any company. You can select it, and there's no underwriting. Now, from a practical standpoint, I want to make sure you understand this. Most people don't do it during those 6 months window. They do it in advance. Most folks that we work with are making these decisions 3 to 6 months in advance of when they want their plan to go into effect. So the majority of people, if they're going to start their Medicare A and B and D and all that February 1, they've made all those decisions, again, 3 to 4 months in advance. And you don't have to for sure. So to answer your question, 63 days on drug plan once you've lost coverage, and then 6 months of your B date, you're still in the open enrollment window with no underwriting required. Okay, let's keep going. All right, Marvin, do you like the WellCare PDP plans? Okay, I am perfectly fine with WellCare PDP plans. Now, listen, last year when WellCare changed the way they did business, they basically kicked all agents to the curb and would no longer work with us, couldn't have contracts, couldn't pay us. And by the way, folks, we've never made a lot of money on Part D plans. That is not a big income generator at all. But at least they compensate us a little bit for our time. And then they pulled that. And so it was very last minute. We didn't know for sure why they did it, what they're going to do, and they got sued like crazy by some large companies, and they settled for millions of dollars. It was a wrong move on WellCare. But their plans have still proven to be adequate in some markets. And so I would not shy away from a WellCare plan if indeed that is showing up in the list of plans as number 1 or maybe number 2. So I'd be fine enrolling into that plan, okay, for sure. So that's how I feel about it. And now, do I think they did wrong? Absolutely. I'll be frank with you, all of you. They stole $1.5 million from us. That's what they owed us, and we did not get that. And I think that's wrong, but again, that's on their conscience, not mine. We just had to live with what they did. But again, we'll write those plans when it's in the people's best interest. So it's not about us, it's really about you. So that's my 2 cents. Let's keep going. All right. if I have FEHB, for you who don't know what that is, that's Federal Employee Health Benefits. This is someone that's retired as a from the civil service. Could be IRS, Homeland Security, FBI, whatever. That's FEHB. Which option will I pay less out if pocket expenses for doctors, hospitals, etc. if I get A, basic, and supplemental G and D, or if I keep FEHB and get AB and MA only? Okay, so let me kind of explain first. You have to know that your first option you mentioned, if I get A and basic, which is your Blue Cross Blue Shield, you are not going to get a supplemental plan G. Because when you get a supplemental plan and you have FEHB, you are terminating your FEHB. So you would not do that scenario. And a lot of folks aren't aware of that. But you actually, if you had a B, your basic with Blue Cross and a G, in my opinion, you're way overinsured. So I would not do that. Because if you keep the basic and a supplemental plan, you're paying premiums for both of those. So most people that want a supplemental plan that are with FEHB will actually terminate their FEHB. It's permanent. There's a form you have to fill out, and that money will no longer be deducted from your civil service annuity. Okay, so you could do A and B with the supplemental plan and a D plan. Okay, and many people retiring are doing that today. But then you said, or if I keep FHB and get A and B and MA only. So those are, of course, two totally different programs. So if you did an MA only, you're going to stay enrolled in your FEHB plan. You are. You're going to get your meds through FEHB. You're paying a premium, so you got to keep paying that. But then the MA only, what they're going to do is they're going to give you credit on your Part B, and then you're going to be, basically what FEHB does is they will actually coordinate with that MA only plan. All right. So what I'm trying to say is, I don't know for sure, how often you're going to the doctor or what kind of issues you're dealing with. So it's difficult to tell you exactly what your out-of-pocket expenses are going to be. But I would say this. Here's my rule of thumb. If it is costing you $350 per person to be on FEHB, I think it's smarter to get out of FEHB, enroll in A and B, and then get that supplemental G or N plan. I think that's better. If you're afraid to terminate, you don't want to terminate your FEHB permanently, then you're not going to get a supplemental plan. Then you're going to get that MA only plan. And I think that's a great option. We rate those all the time. And the beautiful thing about that is it's not permanent for you. If you don't like that MA only option, you just go back and you just have A and B with your FEHB benefits. So that's also a good option. So it really boils down to what does it cost you. We had a lady the other day, and I have no idea who her carrier was. It wasn't Fed Blue, somebody, but her premium was over $600 a month for her FEHB plan. A single person. Well, Medicare, we blew that out of the water. We got that down from $600 down to $200 plus her Part B. So she just did not have a good FEHB plan. So that's my 2 cents. All right, let's keep going. I'm 64, still working full-time medical. Can I delay signing up for Medicare until 67? How is that done? Okay, well, as long as you are working and there's 20 employees on your company's payroll, you don't have to do anything with A, you don't have to do anything with B, okay? And so that's to answer your question. You're still working and plan to. And then what you're doing is you're going to come into Medicare at 67. That's a different enrollment period. Your initial enrollment period, called the IEP, is at 65. But you don't have to use the IEP if you or your spouse are still working, covered by a group plan 20 or more. You can pick that up at a later date. Now, I would encourage you to do this. If you do not have an HSA, a health savings account that you're contributing to, then I would still, at 65, enroll into A only. It's wise to do that. Now, if you have an HSA you're contributing to, don't do A, certainly don't do B. Do nothing, and you will be fine. And so what happens when you come in at 67, the only key to that is we have to prove you've had credible coverage. That's active employment, folks, and insurance through work. And COBRA doesn't qualify. Active employment insurance all the way back to 65. That could be one employer, it could be two, could be your spouse's, doesn't matter, but we have to have every single month accounted for back to 65 to come into Medicare later using the SEP. And really is very simple, as long as you've had credible insurance and work back to 65. Okay, so that's the process. Let's just keep going. Hi, do you have to have a SUP plan? My current plan is around $300 a month, but I don't use even a fraction of that. No, you don't have to have a SUP plan for sure if you don't want one. But I would say this. Please don't just drop the SUP alone. What I would do, if you don't want to pay for the SUP any longer, then please enroll into an Advantage plan. Because if you just drop the SUP and you have only A and B only, now you have a lot of financial risk. So reach out to us and we can look at those different Medicare Advantage plans in your market that will also include a prescription drug plan. It'll be embedded and usually at zero cost. Okay, and so again, you can drop it. It's fine. Now, this is the only time of the year you can do what I'm suggesting. You can drop a SUP anytime you want, but you can only add an Advantage plan in this scenario October 15th to December 7th. Again, we can accommodate that and we'd be delighted to help you. Okay, you can do it. Let's keep going. All right, my Advantage plan for next year has been canceled. I went on Medicare in 2018. I was told I could go on a supplemental plan, but only a plan F without medical underwriting. True or not? Okay. Yes, that's true. So what happens, those of you that aren't familiar with this, we call this guaranteed issue. So Medicare back in 2015 revamped the whole system and made some laws. They did it in 15, but they made it effective in 2020. So the rules are, if you started Medicare before January 1, 2020, you could get a Plan F, and you get all the plans, but you could get a Plan F. And if you are in a scenario now like this situation where you're losing a Medicare Advantage plan, you have a guaranteed issue right. But the guaranteed issue right means you can get a supplemental plan with no underwriting, but the one you can qualify with no underwriting guaranteed issue is based upon when you started Medicare. So again, if you started Medicare before 1/1/2020, we can come off the Advantage and we can get a supplemental plan, but only the F plan with no underwriting. Now, if you're healthy, you could get a G, you can get an N. But if you're unhealthy and can't qualify medical underwriting, then you're going to have to take that F plan. That's the way it works. Now, if you were terminated, and I know this person was before 2020, but if you were terminated and you started Medicare after 2020, then you would be a guaranteed issue G plan. All right, so it's all based upon when you started Medicare. Okay, so it was true. All right, how can I tell if the specific inhaler I use is in the formulary? Last year when I switched, the new company said it was, but it wasn't. So I had to get an exception letter. Guess I'll have to do it again. Well, if you're on the same plan, normally those formulary exceptions, I think they stick. Okay, I think they roll to the next year if you're on the same plan. You may want to double check on that. The second thing is if you change plans, yes, you would have to have formulary exceptions. So the answer to your question is this. Go to our site, MedicareSchoolEnroll.com or Medicare.gov, whatever sites you want to use, and put that inhaler in your list of medications and then shop it. And then what's going to happen now on our site, because I use it all the time, there'll be a block there where it says prescriptions. And you can click on prescriptions and it will give you the details of your prescriptions, whether there's a quantity limit, whether there's a prior authorization, those kinds of things. You'll be able to see if it's in formulary or not. If it's not in formulary, all the meds that are in formulary are listed, and then there's a block there that says these medications are not covered by the plan. So what I would do then is try to find a plan that does cover that medication, especially inhalers. They can be very expensive. And so try to find one. And so if you're on Medicare.gov or our site and your medication list is there, it'll show up all the plans and let you know. And it's very simple because it'll say 5 of 6 meds covered, 2 of 2 covered, 7 of 7 covered. And then if they're all covered, then you can open up that plan and you can see what your copay would be. So that's the way you do it. All right, let's keep going. All right, I live in one of the states that SUP plans are adding pre-authorizations, okay? And I still don't know what all the 17 items are. How does this impact the advice on SUP G or N going with Advantage? Okay, well, first off, when it comes to your question and pre-authorizations, we are not definitely comparing apples to apples at all, okay? So pre-authorizations right now, and those that they're adding, and you're saying 17, and that I think that's right. I thought it was 19, but nevertheless, it's in the teens. So what I would suggest doing is if you use ChatGPT or some kind of a search engine AI, ask them what are the new pre-authorizations being added to original Medicare, effective 1/1/2026, and you'll find those. I've been through the list. And so what's going to happen now is those items will be required for the provider to do a pre-authorization if the provider wants to make sure they get paid. A provider does not have to do a pre-authorization even on those services. They don't. But in order to get paid, then they have to submit the information to be sure they file the claim. So if it really is necessary, Medicare is still going to pay, and they don't have to do a pre-authorization. But to get paid, they're going to have to prove it. So all they're basically doing is saying there has been a tremendous amount of fraud and abuse within these particular codes within Medicare. Before this, Medicare had 12 services. Now they're adding these, 17 codes. And so all of those were already pre-authorizations in the Medicare Advantage system already. Okay. And so now, why did I say we're not comparing apples to apples? Because in the Advantage system, you don't have, a handful of pre-authorizations. 27% of all the services needed on an Advantage plan will have to have go through the pre-approval process. Okay. If you're an original Medicare and you have a supplemental plan, you're not going to have a pre-authorization to get a knee replacement, a hip replacement, an MRI, CAT scan, but you always would on an Advantage plan. So again, that's what I'm saying. You're not comparing apples to apples here. So my studies, here's what I found. There's 7,000 billable Medicare codes, 7,000. We had 12 procedures before. They just added these 17, okay? So if there's 7,000 billable codes, that means that's the same would be true for Medicare Advantage. And so 27% of those require pre-authorization if you have a Medicare Advantage, okay? So again, you're not comparing apples to apples. You have a fraction now in the original Medicare system. None still by the supplemental plan. Advantage plan is 27%, and that's by the health insurance company. See the difference? So again, you got to separate the two. Not minimizing the pilot test they're doing there. Now it's 5 years, all that, but there was good reason for it. But I'm telling you, doctors still don't have the pre-authorization. They don't. But the risk is on them to prove that they really should have done that skin graft, or they really should have done whatever they did. Okay, I've said enough. Let's keep going. Retiring next year at 65 in March. Your content has been very helpful in my early journey. Any advantage of using Medicare School versus a local insurance broker? Of course. There's an advantage. We will take care of you. And by the way, I think there's some great brokers around the country for sure. But many times, and I don't know your situation, but sometimes local brokers are small. They work out of the trunk of their car, and they can only handle so many people. We're a large company, and we have our own customer service department. So we take care of our people. I don't know about your local insurance broker. Many times, local small brokers, they're concerned about one thing, and that is adding clients. That's it. They're just trying to build their book of business. And if that's all they have, and they don't have the staff to service you, they may have written the right initial plan, but are they going to take care of you for the long haul? I know we do, because I know what it costs to run our customer service team. We spend a lot of money. Our clients are not forced to call the insurance company to get help and be transferred to the Philippines or India or China or some offshore call center. When they need help, they call us right in our home office in Overland Park, Kansas, right outside of Kansas City, and we speak English and we know Medicare. All right, so that's the point. I think we come with the whole package. Anything your broker can do locally, we can do. Plus, we have our own customer service team. So to me, that's the benefit. So let's keep going. All right, what was the name of your Medigap website? It's called medigapcompare.com, medigapcompare.com. You put in your age, your zip code, and it'll give to you the 3 lowest carriers in your market, okay? Not all of them. They're looking at all of them, but they're going to give you the lowest 3, okay? Okay, still working at 68 next year is it. My wife and I have at 65. Good. Should I start Medicare now and dump my work insurance to be ready? Planning on retiring end of 2026. I wouldn't. If you like your group plan and it makes sense financially, don't worry about that. I just would not. Because folks, let's say that you're planning end of 26 to start, but it happened mid 26. Listen, if someone called me today, and what is it, 15th, right? And they said, Marvin, I've got to start Medicare November 1. No problem. No problem at all. We can pull that off very quickly. Folks, I have done it. I've done this the last day of the month, as long as it's a business day. Now, are you going to have your Medicare, cards in hand and all that? No, but you're covered. Because as long as we do a plan submit by the last day of the month, we can ask for an effective date on the 1st. So my point is, if you like your insurance, it's a good price. Don't feel like you got to drop it now because it's going to take forever to get on Medicare, because it's not. So ideally, what we tell people, 60 to 90 days before you know you're going to lose your group plan, then let's talk. Let's get together. Let's make an appointment. 60 to 90 days, because the paperwork that's involved with you, because you're coming in after 65, you are, she's not. There's going to be some paperwork. Your HR fills out one. There's another one you have, and that paperwork cannot be dated any sooner than 90 days of your effective date. So if you're going to retire at the end of 26, that tells me you want your plan to start January 1, 2027. So ideally for you, you start working on this October 1. And that's really the easiest way to do it. Okay? And so stay on the plan. Now, if it's a lousy plan, then go ahead. But don't do it just because you're thinking it's going to be difficult when the time comes, because it really is not. And you work with us, we'll make sure it's a smooth transition. Okay, next. I spoke with one of your agents on Medicare Now, and he gave me 3 companies in my area, Aetna, Anthem, and United Healthcare. I was on an employee health plan, so didn't use Medicare. I would like to speak with one of your agents again. This is confusing to me. Need more information, please. Okay. Well, Laura, reach out to us, please. And so as long as we had your name, it was saved in our database, and more than likely that agent is still with us. And so if you want to call in and tell the reception team that you've already talked to somebody and would like to have another appointment, and it could be that agent would be available for a live transfer. That happens. So again, just call in again, and we're happy to go back and review whatever was discussed before. And if you're confused, where you feel like you want some kind of maybe some education, just go to our website, medicareschool.com, and watch my Essentials workshop. It's free. There's no obligation, no cost, and it's 50 minutes. So it's 50 minutes of time well spent. And then again, call and you can speak to one of our agents. We can talk about prices and review everything, answer your questions. Okay. We'd love to help you. Okay, I have not received any notice from my supplemental plan, AFLAC, about what my 2026 premium will be, nor have I received any notice or increase from my plan D from WellCare. Okay, number one, we're talking about 2 different things. Your AFLAC supplemental plan, it probably is not tied to this time of the year. Supplemental plans are normally locked in for 12 months. So I don't know when you went into effect, but if let's say you went into effect in June, well, then you're not going to hear about your price increase until 30 to 60 days before your policy effective date. So again, if that was June 1, you're going to get the information April, May, okay, on the AFLAC policy. All right. Now, for your Part D plan with WellCare, I'm not totally shocked. I've had a lot of people tell me they did not get their ANOC. So if you want to call WellCare, then you can ask them to send you an annual notice of change. But another way around that, if you're our customer, you can go to liverxhelp.com. We do it every day at 2 o'clock, and we can walk you through those plans to make sure you know how to make sure you're on the right drug plan. If you're not, you can also go to medicare.gov and look at that information, because that WellCare plan will be in there. And all you have to do is open up a tab that will explain, how the plan's working, what your copays are going to be. But all those details will be on those platforms. So you don't have to necessarily wait for the annual notice of change, but you could if you want. You have up until December 7th to make this switch. Okay? Hope that helped. Let's keep going. Your team helped me select this up last year. It's difficult to switch to another sub plan if an alternative is less expensive. Well, not difficult as long as you're fairly healthy. Most states you have to, you have to medically qualify to make that switch. But it's not hard, and we'll facilitate that. And when we talk with you, we'll ask you the health questions in advance so we can get a feel for your pre-existing health conditions. So if you have some real serious ones, then yeah, it could be difficult. But if you're fairly healthy, then it's not hard at all. And we do all the work anyways for you. Okay. All right. The only thing we can't do is we could not cancel your existing supplemental policy. We'd tell you when to do that, but we can't do that. So if someone says, hey, Barbara, I want to start a new plan December 1, we're going to go through underwriting, we get approved, and then we would have you call and cancel your supplemental plan mid-November, and because your new plan goes into effect December 1, and we just don't want there to be an overlap of premiums. Okay? All right. Once I sign up for a different Part D plan, do I need to contact my current? No. No, the system only allows one at a time. So when you make an election to change drug plans during just October 15th to December 7th, and when that enrollment goes through, it goes to Medicare. Medicare approves it, and they will automatically kick your drug plan out that you're on 12/31 of this year, and your new one goes into effect January 1st. All right. Do we know the premium for Part B? No, not yet. These are all tied to indexes, so about probably the most reliable source right now that is predicting this is saying it's going to be $206.50 for the base. That means if your income is below the thresholds, $206.50. And again, we don't know. I'm just saying to you, those that follow this, I think this one was the senior league or something, and they're believing about $206.50. So it's going up, from $185. So what is that? $21.50. They're speculating. Okay. Anyone else? Okay. Can you help me find affordable Medicare supplemental plans in Wyoming? Yes. The plans I found have premiums that are okay. Well, we can definitely shop and see. We're brokers in Wyoming, so we can actually look and see what is going on in that market for sure. Happy to do that. We write for almost everybody in the country. I can't say everybody, but almost. So if you want to call in and talk to one of our agents, we can pull those up very quickly and tell you what rates are. And then, if you can't afford them, if you can't afford a G, definitely look at an N. Still a very, very nice plan. And then if that's not affordable, then you may have to look at an Advantage plan. And probably not very many of those in Wyoming, I'm assuming. But call in, please. Our agents are licensed in all 50 states, so we can help you and be happy to do so. All right. Anybody else? Do you opt out of HSA for A? Well, I'm not sure your question. So if you do have A, you can no longer put money into an HSA if it's your HSA account. Okay? So if you have an HSA and you're still working, then I would not take Part A. And just so you know, if you make a mistake on Part A and you go ahead and enroll in A, as long as it has not gone into effect, and if you make a mistake, you can disenroll from A. But if it's gone into effect, you cannot disenroll from A. Okay? So if we have A, no new money goes into the HSA. If we don't, then you can go ahead and put it in. Now, here's where it gets a little bit confusing. Let's just say that let's say the wife is working, the husband's on the wife plan, and he is retired, and he has A. As long as he is A only, and he is covered by her group plan, you're still eligible to make a complete family contribution. Okay, you can. Your worker has A, then that's off. You can't. So it's very unique. So we have the younger worker working, contributing to HSA. The spouse is on the group plan and has A only. Then you can still contribute the full amount for family. It's just a little bitty loophole there that's very interesting. Okay. All right. Hope that helped. It didn't confuse you more. Mother will be retiring in December. She will turn 65 on April 3rd. When should we schedule an appointment to give you guys a call to get her started on her Medicare enrollment? Okay, well, she retires in December, turns 65. Okay, so ideally, really any time, December would be fine. We can start looking at things anywhere from 3 to 6 months in advance of her start date. She will start Medicare April 1. Now, if she's already on Social Security, probably not, but if she is, you'll be automatically enrolled into Medicare. And that's what I want everyone to remember. Anyone that's taking Social Security benefits, retirement, spousal, or survivor benefits, you're automatically enrolled into Medicare and you get your card about 100 days prior to your effective date. So her effective date is April the 1st. So back up the clock. If she's on Social Security, March, February, January, she'd get her Medicare card around the 15th of December. Her card would show up in the mail. It's 100 days prior to the effective date. If she's going to self-enroll, that self-enrollment system will open up for her January 1. So you're asking, when do you reach out to us? I'd reach out to us November, December range and get on our calendar so that then we can take care of all that for her, and we'd be happy to. Okay, so we can do the enrollment, January 1 for sure. So reach out for an appointment, and that's plenty of time to get everything taken care of for her. And we'd be delighted to serve as her broker, and we'll help her. All right. Let's keep going. I retired in January, age of 71. Good. I found a Cigna F plan in the same price almost as a G plan I was looking at with another company. Well, F plans go up quicker than G plans with good companies. Well, possibly. And the reason I'm saying that is because it just depends on how large of a group it is. But if it's a new F plan, my only concern would be that there's not that many people taking F plans, so it's definitely going to be a smaller group. The reason the price is reasonable right now is because the only way most people are getting F plans is if they're going through underwriting. So that's probably why that price was competitive. So would I do that? I wouldn't. I wouldn't take the risk of that. If you can qualify for a G plan, meaning make it through underwriting, that I would get a G plan because more people are buying the Gs. That means you're going to have a larger group, and they're younger as well. So I think the possibility of rate stability is much stronger with the G than with the F. Now, if you're saying to me that you can't medically qualified, then that's a whole nother issue. But it sounds like to me that you're going to be new to Medicare B anyways. So there's no medical qualification in any plan that you get. So I wouldn't select an F, even though it seems to be competitive right now. I think the likelihood of that changing down the road, 5 and 10 years down the road, I think if we had a crystal ball, I think we'd see that those rates will not be quite as stable as a G or an N plan. But if you decide to do it, again, I don't think you're crazy for that, but I don't think that's what I would do. All right, let's keep going. I've had a plan in for 8 years. If I choose to, can I change to a different plan, or am I stuck? No. In most states, in order to make that plan into a G, you would need to medically qualify. So you're not stuck as long as you're halfway healthy. You can switch. So I'm assuming you're thinking about maybe moving end to end, and that's really something that I'd consider. And again, you can use our company to do that. We'd be happy to help you with that. Just give us a call, set up an appointment, and then we can shop those rates to see what's available. And then we'll also look at the medical underwriting criteria because they vary company to company. Some companies are extremely strict and other companies are lenient in certain areas. Insulin-dependent diabetics are a great example. Some carriers will not take you if you're insulin-dependent at all. Some will, as long as you're not taking any more than 50 units of insulin a day. Some will take you as long as you've not had a retinopathy or neuropathy. We'll have carriers that don't care about height and weight. You could be, have body mass that's large, and companies don't even ask the question. Other companies want to know your height and weight. So my point is, we're brokers, so we know, what these carriers are looking for. So we try to find a carrier that we can get you through underwriting, because sometimes we'll have a carrier that will say no, another carrier will say yes to the same person, right? Because they're looking at different criteria. Okay. Anyone else? All right. Age 70, kind of switch from traditional Medicare to an Aetna or Humana Advantage plan. I can't afford a supplemental plan, so could take only A and B at age 65. Yes, you can. You can switch to an Advantage plan one time a year, and that's this time. So if you want one, please reach out to us. We will facilitate that. And so we'll also look at both of those companies, and there's also usually 5 or 6 different companies. I think the average market this year is going to have about 35 to 40 different Advantage plan options. That's average. And so we can look at all those really at a glance for you and talk about the differences. And so you can add them. October 15th to December 7th, and that Advantage plan then would go into effect January 1. It's the only time of the year, if you have A and B only, that you can add the Advantage plan. Okay, anybody else? I received Medicare and ANOC, which cover the prescription premium costs for next year, but should I have received an ANOC for the supplemental plan as well? No. ANOCs are only Advantage and Part D plans. When it comes to your supplemental plan, your coverage can never change. Your premium can change, And that you're usually notified 30 to 60 days before the anniversary of your policy. All right, but there's no ANOC with supplemental plans. All right, to my staff, I'm going to wrap this up. I'm tired. We've been at it a while, so this is going to have to be my last question, okay? And I'm sorry. And for those of you that are interested, I will be doing another one of these tomorrow for our clients at 1 o'clock. I do 3 of these a week and a couple during the evening, so I'm worn out. So I think I did 2 live workshops already this week and lots of online stuff. So here, one more. I received Medicare. I already did that one. One more. And then let's wrap it up. On non-disability, I'm going to turn 65 in February. I need help in figuring out if any of my coverage, dual medical and Medicaid, is going to change. Help. Yes. Okay. We can help you with that. Those are called dual SNP plans. And so what will happen is if you're already on Medicaid, you're probably not going to lose that eligibility. And we have ways to be able to discuss that with you and help you with that. So your dual SNP Medicare Advantage plan would go into effect February 1. And all those are out. So if you want to call in now, we're happy to look at those options and figure out which plan's going to be best for you. Most of the markets are going to have at least a dozen different dual SNP plans available this year. So there's a lot of them. So we'd be happy to shop those for you and help you through the process. So we'll help you. Just give us a call. Let us know. All right, folks, thanks so much. Again, tomorrow at 1 o'clock, I'll be doing this again, and then next week as well. Anything that we can do to help you. If you need a broker, I promise we'll be honest with you, we'll be thorough with you, and do everything we can to make sure that you're on the right plan initially and then in the future as well. Take care. Thanks so much. Bye.